Did you know heart disease is the #1 cause of death in women aged 20 or older? The American Heart Association wants to change those statistics, and Lori Fovell is the communications director for the American Heart Association. Now, I want to tell you that Evan Fee is also with us. He's with Cintas Health and Safety. You are a specialist for them as well. I'm sorry about that. All right, now, Lori, how are you going to go about reducing those numbers?
Well, the good thing about heart disease is that it's largely preventable for both men and women. And the message of the American Heart Association is that small steps can bring about big changes in your heart health. We call them Life's Simple 7. So I'm going to give you 7 tips.
All right.
If you follow these, you will greatly reduce your risk of heart disease. The first 3 are knowing your numbers. A quick visit to the doctor. Blood cholesterol, blood sugar, and blood pressure. So the next 4 are things that we probably already know, but we may not be doing: to eat better, lose weight, exercise, and quit smoking. Do these 7 things and you will greatly reduce your risk of heart disease.
Are there things we can learn to help us along the way and to help other people maybe too?
Right. You know, the things I just mentioned are things that we can help our own hearts, but one thing, and what we're going to talk about today, is what happens if you're with somebody who does have a heart incident. The important thing during the month of February is maybe to get some training. The AHA trains on CPR, life-saving skills, and we're going to see a little bit about that today, now.
Okay, so Evan, you brought these things. What in the world are these things?
Right, this is one of the mannequins that we actually use in class, and this is one of our newer defibrillators that we actually are using in class as well.
It's amazing how small these things have become.
Right, it'll be in your pocket before you can even believe it. So what the defibrillator actually does is that the defibrillator can get your heart back to a normal rhythm, where many people think CPR is what gets your heart back to a normal rhythm. That work is actually being done by the defibrillator, and they're very simple to use. You can see it has an on-off button and a shock button, so just about anyone can figure out how to do it.
Really, anyone can learn, or do we need to be trained specially?
That's correct. Whenever you buy an AED, training is something that should go along with it to make sure that they're properly trained on the unit itself. However, they're made this way for a reason, so just about anyone can understand how to do it. And we'll go ahead, we'll show you right now if you'd like. So with
I can't believe you could possibly do this. Go ahead.
With this unit, this is the on-off button, and this is the shock button. And on this unit, you actually have a screen which shows you how to actually do CPR and use the defibrillator. So the first thing you want to do is turn the AED on and attach the pads. And Lori's going to take the AED for me.
All right.
So we'll go ahead, we're going to open up the pad package, just like so. Place the pads in the upper right chest and the lower left chest, just like it's shown.
Up here and down here.
Yes, that's correct. And we'll put it on the mannequin today.
Oh, that's a good idea.
I don't think Lori wants to have the AED on.
I'm not getting no shocks today.
No. So we'll go ahead, we'll put this right here, and we're going to turn this unit on. We're going to put this into demo mode right here, so it can cycle through the entire unit.
Yeah, and then...
There we go.
Because I don't want us to run out of time with this. Wow.
Call for help. Analyzing heart rhythm. Do not touch
So it's important we don't touch them during the analysis right here.
Yeah.
Stand clear.
Okay.
Shock advised. Charging.
So if someone is in a shockable rhythm, the defibrillator will charge up and we'll be prepped for shock. So Lori, go ahead, hit the shock button there for me.
Shock 1 delivered. It is safe to touch the patient. Begin CPR now.
And I'll place my hands in the center of the chest, and this defibrillator will actually count you down starting from 30.
Can you take classes for this? Are they available for people to do?
Yes, this is actually what Cintas and the American Heart Association are teaming up to do. I do all the instruction, and she's from the American Heart Association.
And so how can people get involved in that? Either of you can answer that.
Sure. You can ask your employer if they provide any CPR training, if they have a defibrillator. If not, you can sign up and you can get an AED. Unbelievable. It's amazing to me, the technology, and it's wonderful that these things can be just about anywhere. Thank you guys so much. And guys, don't forget the Mercy Heart Mini Marathon and Walks coming up March 20th in downtown Cincinnati. You don't have to be a runner to take part. There are events for walkers and kids, even for stroke and heart survivors. So for more information, just go to WCPO.com. Thanks a bunch. Thanks for